Brown discharge after period. Causes of a brown discharge after a period. How to treat the condition. Brown discharge after period. There could be a number of reasons that may result in a brown discharge after a period. While in some cases it may be normal, in others, it may require medical attention. Vaginal discharge is a part of the menstrual cycle and its appearance and meaning may vary as per the stage and time of its occurrence. A lot of women experience brown discharge after their period. Of course, the reason for the same may vary from person to person. As a matter of fact, a brown discharge after the menstrual cycle is not always a cause for concern or a warning sign for any critical condition. There are chances that a perfectly healthy woman may also experience a brown discharge before, during, and/or after a period. Let's get to know what the causes of such an occurrence are. Causes of a brown discharge after a period. Delayed period. More often than not, a delayed period can lead to brown, dark red and/or dark brown discharge during and after a period. Most of the time, brown discharge after a period is often related to the endometrial tissues, lining of the uterus, which gives way to menstrual bleeding. Remnants of the older endometrial tissues may appear brown when discharged from the body, which we can also say is the cleaning process of the uterus, because blood that is old will look brown, so tissue with old blood too will look the same. Damage to any internal part. In a slightly more serious case, the brown discharge may be altered blood, meaning it has appeared as a symptom of some kind of damage to any internal part of the reproductive system, which may require thorough examination. It could also be due to some kind of erosion, polyps and/or injury to the surface or the mouth of the uterus. Implantation bleeding. There are chances that you might notice a brown discharge after 3 to 4 weeks of the menstrual cycle, especially when you had unprotected sex recently or have not taken a birth control pill. This discharge may signify implantation bleeding or spotting, which is also an early sign of pregnancy. Other causes. There are many other causes that can lead to a brown discharge. They can be serious medical conditions. Repeated yeast infection. Pelvic inflammatory disease, PID. Bacterial vaginosis. Cervical cancer. Sexually transmitted diseases, STD, for example chlamydia, vaginal warts, gonorrhea, etc. Several phases of the menstrual cycle like perimenopause and menopause may also cause a brown discharge after the menstrual cycle. How to treat the condition. Getting to the root cause of the problem by just observing the brown discharge is slightly difficult. However, watching out for the duration or the amount of time the vaginal discharge lasts can be of some help. As mentioned earlier, if the brown discharge is noticed as a result of a delayed period, it will stop within the duration of the menstrual cycle. If the problem continues, it is best to see a gynecologist and get to the root of the problem. If the cause is serious, then the discharge may be accompanied by several other symptoms such as itching, vaginal dryness, pain during intercourse, skin rash, frequent urination, loss of appetite, uterine bleeding, burning sensation inside the vagina, mood swings, and depression. The aforementioned symptoms should not be overlooked and one must immediately consult a doctor to discuss the issue freely and get it resolved at the earliest. The treatment for brown discharge after a period will be in accordance with the cause of the same. Your gynecologist might provide simple medication or small dietary and lifestyle changes to tackle the problem. In serious conditions, supplements, surgery, chemotherapy, pap smear tests, and other medical tests may be required. Remember that most of the time, it is not a very dangerous situation. However, if it prolongs, it is better to go and see a gynecologist and get the problem evaluated. Early detection of the problem is the best way to prevent it. Take care.